Hey, good afternoon, hello, and welcome everybody to this high-level conference on research perspectives on the health impacts of climate change. It's amazing to see you all here in a full room. We're at full capacity, live here in Brussels, all together. And to all those of you watching online, I'll simply say good morning, good afternoon, or good evening from whichever part of the world that you're watching from. And thank you so much for tuning in. Now, my name is Hajar Yagkoubi. I'm a former United Nations Youth Delegate for the Netherlands. I'm one of the co-founders of an intergenerational network called 2100. But above all, I'm very delighted and honored to be your moderator for these 2 days that we get to spend together here in Brussels. And not the least of which because we have an incredibly exciting program laid out ahead for you, but also because the topic that we're convening on is incredibly important. I mean, if there is ever an audience seated in front of me that I don't have to explain this to, then it's you. You know this, of course. But that is also exactly the reason why the Commission's DG Research and Innovation wanted to organize this conference and bring people together. And when I say bring people together, I do mean bring people together. Look around. We will be with over 450 people in these upcoming 2 days. We have 80 speakers from all over the globe. We will have 50 poster presentations. We have a youth ambassador for this specific conference as well. She's seated right here, Omnia Omrani, and you will also lead the Youth Scientist Forum that we'll have, for which I will say stay tuned for tomorrow at 3 p.m. in the plenary, when the outcomes of that forum will be shared. But all with all, I think we can say that we get a big round of applause for all of you guys gathering here live with us. And now, the reason for gathering, of course, is quite straightforward, but I think it's still good to emphasize this. It's to shed light and share insights on the severity of the climate crisis, but also the significant effect that it has on human health, on the impact of the well-being of people all over the globe, whether we're talking physical well-being or mental. We know that this is such an impeding crisis all over and that the interlinkage cannot be underestimated. And it's also specifically to identify research gaps. What our priority needs when it comes to linking the world of climate and the climate crisis to that of health. It's not happening enough, and we need to do that. So I would say no pressure, but that is exactly what we'll be focused on these 2 days. Now, all the input that we'll gather, that will speak into existence with each other, will then be also used to lay the grounds for the drafting of a strategic research and innovation agenda on climate change and health. So what I'm trying to say with that is that every input, all the input that will be shared throughout a stark foundation that we need in the way forward as well. And that is what each and every one of you will do here. And because of that, we also want to make sure that this conference will be as interactive as possible. And when the moderator says interaction, you know what time it is. I pull out Slido. Can I see hands for people that are familiar with Slido, who's worked with the Beastie before? Okay, I see quite some hands. To those of you that don't know Slido, you can use it throughout these upcoming days to ask questions to speakers, to share your own input, because we will be debating and discussing and having conversations amongst ourselves as well, but also even to vote. And if you're wondering, voting on what, then I will keep you in suspense a little longer, because I will get back to that somewhere later on today. Now, you can scan this QR code, but you also have a badge around your neck, your lanyard, yes. If you turn it around, you will see that there's the same QR code for Slido as well as a Wi-Fi password. But, and now you should all pay close attention if you want to be connected to the online world in these upcoming days. The password is just slightly incorrect. So listen now or forever hold your peace, I will say. The thing you have to alter is that the password is Lemaître, but the D is supposed to be in capital letters and the rest is lowercase. So if you plug that into the Wi-Fi, then you should be able to access the online world, which is a big revelation, I shall say. If you're on the online world, and if you hear amazing things that resonate with you throughout these days, or things that maybe spark some thoughts or other ideas that you might have, we have a hashtag for these upcoming days that you can use if you're tweeting or Instagramming or TikTok dancing about climate and health, and that is EU Climate and Health. So make sure to use it, because then we'll be able to find each other's posts, and I think that's always a nice collection to have at the end of everything. Now, I've babbled a lot, but you've come here for content. Harsh content and important content, which I applaud you for. So I will say, let's just jump straight into the program for today, and to bring all of you as renowned experts to the critical question, which is our reflection that is needed on current challenges, on priorities and needs for climate change and health research. And to kick off that reflection, I am incredibly delighted and honored to welcome to the floor for opening remarks our very first speaker of today. She is the Belgian Minister of Climate, Environment, Sustainable Development and the Green Deal. Can we get a big round of applause for Her Excellency Zakia Khattabi, everyone? Minister Khattabi, if you want to use the lectern, please go ahead.
Thank you. Thank you. Thank you very much. It's okay with like that? Okay, you hear me? Okay, honorable delegates, commissioner, distinguished guests, ladies and gentlemen, it's really with a great pleasure that I stand before you, but also with a deep sense of responsibility as Minister in charge of Climate, Environment, Sustainable Development and Green Deal. Allow me to start by thanking the European Commission's Directorate General for Research and Innovation for organizing this conference and for inviting me. So when I took office, I sent a tweet. Climate change, it is not a question of belief, it is about science. You see it here. There is no longer room for doubt. Climate change poses one of the most significant challenges of our time, with far-reaching implications for human health. Science is essential to inform and inspire an ambitious evidence-based climate policy. The IPCC reports reminds us year by year of the urgency to take action and achieve the objective of the Paris Agreement. The latest IPCC synthesis report is clear. Every increment of global warming will intensify multiple and concurrent hazards. Extreme weather events cause climate-related mortality, illness, and suffering. Both communicable as well as non-communicable diseases are exacerbated, and the pattern of spread of infectious disease are changing. The tiger mosquito has already established itself in several European countries, including cases of local transmission of dengue and chikungunya in France and Italy. Even here in Belgium, tiger mosquitoes were observed in 25 locations last year. What can we expect in the future, and how will we handle these challenges? The World Economic Forum spoke of probably 14.5 million additional deaths and $20.5 trillion in economic losses caused by global warming and health impacts by 2050 worldwide. We need science and research to guide our actions both nationally as internationally to deal with these devastating numbers. At last year's COP28, there was for the first time a health day. Going back even further, at COP26, Belgium already committed on constructing a low-carbon, sustainable and climate-resilient health system. We will need to make our system health climate resilient, as climate change is impacting not only our health, but also our health systems. But we will also need to make sure that our health system becomes more sustainable. Today, an average share of around 5% of overall greenhouse gas emissions are due to the health system. This will need to change, and we will need science to guide this transition. Belgium is therefore involved in several national projects, some of them funded by our Belgium Science Policy and international projects relating to health and climate with various partners. Together with Healthcare Without Harm and ARUP, we are currently assessing the baseline carbon emissions of our health system, which will be the basis for our roadmap towards decarbonization of healthcare. Simultaneously, Belgium has made significant strides in enhancing climate resilience. The 2021 report on the impact of climate change on our healthcare system informs policies, while the National Crisis Centre's risk assessment considers climate-influenced risks. The National Adaptation Plan and National Environment Health Action Plan focus on concrete actions like exotic mosquito surveillance and heat wave response. These activities are also reflected in our work during the current Belgian presidency of the EU. Within the environment configuration, we will support the work on the EU's Green Deal policy initiatives, while embracing the One World, One Health approach and taking forward this endeavor in the next strategy agenda. Circular economy, climate adaptation and resilience, and a just transition are key priorities, recognizing their direct or indirect impact on both climate and health. The 22nd of April, the Belgian Climate and Environment Risk Assessment Center will organize a high-level event dedicated to adaptation and resilience to climate change. This body, created on my request, is committed to long-term and multidisciplinary risk assessments in the context of climate change and by extension, all planetary boundaries. During this event, we will draw from the conclusions of the report that will be released in March by the European Environment Agency and the European Climate Risk Assessment. It will be imperative to integrate their findings into all our policies and sector. We should no longer be talking about health in policies. We should be talking about one health in all policies and break down the existing silos. Climate change requires a holistic and therefore multidisciplinary approach. We should not forget sociology and psychology, which can help foster behavioral changes of citizens to empower them to care for their health. And we should also make sure that our ecological transition is a just transition. We have many challenges ahead of us, and we are still lacking scientific data and forecasting of or prospective models to guide some of our actions. And this is why I welcome with great interest this event. As we speak, the Belgian Climate Center is also having a conference on what steps we can take to enhance our scientific understanding of climate extremes, including the physical and mental health impacts. I'm convinced that both these events will contribute to the development of an ambitious roadmap towards a research strategy articulating climate and health. As we look to the future, it is imperative that the European Union continues to invest in research and innovation. Let us harness the power of science to inform evidence-based policymaking and safeguard the health and well-being of current and future generations. Together, we can rise to the challenge of climate change and build a safer, healthier, and more resilient future for all of us. Thank you.
Thank you so much, Minister. We should strive for one health in all policies. I think that really speaks to the core of it, right? It's about bridging over those silos that we're all working in and making sure that we bring it together and that it's a red thread in everything that we do. And that actually brings me to a lot of delight to introduce our next speaker, because he is truly at the forefront of making interlinkages within the work that he does, but also specifically at the forefront of making sure that we have a more ambitious Green Deal, that we make sure that there is also action. As you said, it's not a question of belief, it is about science. And even when the science is there, we need to push it even a step forward and making sure that we don't remain in a state of inaction. Well, to hear more about the importance of making this interlinkage, I'm very delighted to welcome our next speaker to the floor. He is the Executive Vice President of the European Commission in charge of the European Green Deal, Interinstitutional Relations and Foresight. Can we get a big round of applause for Maroš Šefčovič? Welcome, thank you so much.
And thank you very much for excellent dynamic moderating and for brilliant pronunciation of my name, which despite the many years I work here, it's still rather occasional. But thank you very much for that. But first and foremost, Madam Minister, we are very delighted to have you here, dear Zakia, not only because, I mean, it shows the importance you personally, but also your presidency is attaching to this very important topic we are going to discuss. And of course, it just underlined the excellent cooperation we have between the Commission and the Belgian presidency, which took the helm at a complicated time. This is the transition year, but as you have seen also from the very clear presentations of Madam Minister, we are using every single day we have our disposal to convince our fellow Europeans. The Green Deal is very important, is very relevant, because as you have highlighted, it has really very different interlinkages, and we cannot dissociate the better environment with support for biodiversity and at the same time, of course, human health, which we are going to discuss today. We are meeting in the building which is called Charlemagne. And as you know, it's named after the great European uniter who was crowned as the first Holy Roman Emperor in the year 800. But I can assure you that this emperor didn't have such a warm year as we had last year. And if you look at scientific data, the report prepared by EU Copernicus Climate Change Service, they're telling us that 2023 was the hottest since the last 100,000 years. And we all live in Europe, and we know that this data is correct, and every single year it's hotter and hotter. It's more and more difficult for us human beings living in Europe, for, of course, our vegetations, for agriculture, and simply for making sure that we can continue with the lifestyles as we've been used before. And unfortunately, the trend of the last year is just confirming that the rising temperatures is not a phenomenon when 1 year it goes up, second year it's down. Unfortunately, it goes up all the time. And Europe, even though we maybe do not perceive it when we are looking at the dramatic weather-related disastrous news on our screens, we are actually fastest warming continent in the world. And the temperatures in Europe are rising twice the global rate over the past 70 years. So the climate change is affecting us even more than others, but we do not maybe perceive it as those more vulnerable living on other continents, because we still are better prepared, have a different living standards, and have access to different services that the people in the vulnerable countries where do not have that possibilities we have in Europe. We have also seen that in 2023 there was a record loss of ice, not only from glaciers in Alps, but also in the Greenland, where the ice sheet saw unprecedented melt. So with all these introductory elements I just highlighted, it's quite clear that what we are facing is indeed an existential threat to humanity. And even under the best case scenario from here on, we will see more probably and very likely more frequent and severe heat waves and other extreme events. And the climate change is not just an economic or environmental crisis, because it indeed also threatens our well-being. And the link between the climate change and human health is undeniable. When we looked through some numbers just to underscore the importance of your conference and of the discussions you will have today and tomorrow, just let's look at 2022 on one single country, Spain. In Spain, in 2022, there was more than 4,600 premature deaths attributable to temperatures exceeding 40%. When I saw this number, I was talking with my colleagues in the cabinet, and I said, let's look at the wider picture. And the wider picture is even more troubling, because we look at what was the tendency between 1980 and year 2020. So in this period, the estimates are that it's between 85 to 145,000 of the people who could be still alive, but didn't make it because of overheat, because of exposure to the very, very high temperature. And therefore, I think with this very severe proof that how climate change is affecting our daily lives, I think is absolute imperative for all of us to make sure that we will do everything in our power to meet 1.5 Celsius target, which we agreed as a global community, and we know that we are struggling into keeping that international commitment. And of course, we have also to make sure that we will do very important societal changes, and we will demonstrate this responsibility of society, and will be able to help those who cannot, for example, escape deadly heat waves by installing or running air conditioning. So what I think would be key topics for your discussions would be how to deal with all these negative effects of the climate change, where we would have to manage the decrease in air quality, the loss of nature and green spaces, not only in our cities, but more and more in rural areas because of the lack of water, or the spread of infectious diseases, or even the effect all this has on the mental health, which is the big challenge, as I understood in my discussions in the conference on the future of Europe, especially for the young generation. So I think that on top of this tragic loss of life, on top of the impact on health, World Economic Forum was able to put even monetization, money figure on what this would represent in economic terms. And their report, which was presented a couple of weeks ago, is determining that by 2050, climate change is likely to cause an additional 14.5 million deaths overall, and more than 11.5 trillion euros in the global economic losses. And I think this figure is very important to recall, because when I'm talking to different audiences, very often you have a question, how much does it cost? The costs in a Green Deal are too high. Can we afford it? Shouldn't we slow down? Shouldn't we reprogram? And I'm telling them, don't look at it as a cost. It's investment into the better future. I'm using the example of 2022, where we paid 600 billion euros for import of fossil fuels and 400 billion euros in state aid to make sure that lights are on, the households are warm, and our economy is performing. 1 trillion euro in 1 year. If we can use this money better to go more for cleaner choices, more for renewables, more sustainable solutions for our economy, this value will stay with us because it would be invested in the proper technologies. And therefore, we should not look at the investment into the better future as a cost, but really what it is. That these are the money there for the next generation, for making our systems better functioning under this severe stress, and it will, of course, pay back in the quality of life and in more successful tackling the climate change. So by what I just say, you would understand that I'm clearly with those who would like to see that our response to this enormous challenge must remain bold and must be decisive. Therefore, we are very clearly in Europe committed to our EU climate law, which says that by 2050 we want to be first climate neutral continent. For us, it's legally binding, and this is how we approach it also with our policies. And we, of course, completed under the term of this condition the elaboration of the very comprehensive legal framework for the Green Deal. And I have to say that we are getting a lot of praise for it, a lot of positive appreciation, and therefore I think what we have to focus on now is to implement it properly, to make sure that the technological solutions we are offering will have a business case, that it will be not only public but also private sector which would invest in these technologies and help us to make this the most important economic and societal transformation which is linked with ourselves as a human adapting to the conditions which we created by accelerating the climate change. And I think that based on the lessons over the last 2 years, I'm very glad that we pay more and more attention to health by our research and innovations programs. And I also would like to acknowledge the fact that we have 3 very important Directors General here with us. We have Sandra Gallina, who is our Director General for Health. We have Kurt Vandenberghe, who is Director General for Klima. And of course, we have Marc Lemaître, Director General for RTD, who are actually the host of this event. And I would like to thank all of you for putting this together, because you see that the interest is huge, political support is there, and what we would like to hear from the discussions here, what kind of best advice you can give us, what we should do better in the future so we can prepare the society, we can prepare the European Union in all these challenges which are ahead of us. I believe that it would be properly affected in the EU adaptation strategy, because here what we are doing is to include current and future initiatives as a European Climate and Health Observatory, but also the biggest public research and innovation program in the world, which is called Horizon Europe, because these programs are also funding missions on adaptation and climate change. If you allow me to conclude by what is one of the, I would say, most actual tasks ahead of us, and Madam Minister was kindly referring to this, and this is our work on climate risk assessments. Currently, we are collecting the input from our member states, how they see it from their perspective. And you know that each country is a little bit different. I was talking to you about the drought and lack of water. I had a meeting a couple of weeks ago with the 3 regional governors from Spain. So if you talk to Andalusia, if you talk to Catalonia or even Basque countries, all of them are struggling with lack of water. And I have to say that in particular the meeting with the delegation from Andalusia was particularly striking for me, because they're telling me that in the middle of winter the reservoirs are somewhere between 4 to 20% of they should be. So they are already now planning how to deal with the summer, with the supply of water for their citizens, but also for industry and of course for agriculture production. And this is kind of just demonstration that this is happening today in the Mediterranean, but tomorrow it could be the Central Europe, and the day after tomorrow it could be even Nordic countries. So we just have to learn from how each country is dealing with the climate risk, and we will be preparing together the European climate risk assessment, which we would still like to present to you, to European citizens and our member states in the couple of weeks. And it would be consisting of 2 elements. One, scientific and technical European climate risk assessment, but then also with some toolbox what kind of instruments we have, what we should do, what would be the suggestions, the best advice we currently have, how to manage climate risk for the future. And the last point I would like to make is that we in Europe, of course, are very much focused on how to deal with these challenges in Europe. But we have never forgotten, and we will never do that in the future, that we would forget about our partners in the world. As you know, European Union is the biggest official aid donor, and I was very proud when I could in COP in Dubai announce that if it comes to the climate finance, where we as a developed world committed that there will be a financial transfer of up to $100 billion on a yearly basis coming from the developed world to the developing countries who really need it the most, that we did our job. Europe transferred almost 40 billion euros in that regard. We know that these money are very important, that they are well spent. We will continue with our efforts, and we'll be, of course, working with our international partners that they should do their bit as well. We just simply need to broaden the base. We have more rich countries today than we had yesterday. And I think the Gulf countries, China and many others, should contribute much more to the climate finance. And I hope that this would be one of the conclusions of the next COP, which will take place in Baku by the end of the year. And we, of course, would be very faithful to the WHO Bucharest Declaration, which is covering all the points you are going to discuss. I was looking at your program, and you have all important issues on the table: physical health, mental health, how to deal with infection diseases, how to deal with pollution, and how to cope with nutritious challenges or the lack of water in many parts of the world. And I really would like to thank you for your interest, for your support, for your commitment, and we are all looking forward to your contributions, how to make the world better and safer place for everyone. Thank you very much.
Thank you so much. A big round of applause for EVP Šefčovič. As we move on to this next panel that we'll have, because I truly want to thank you also for putting the cost into perspective. I think you were absolutely right when you said to remember those statistics, because usually there's even a financial argument to be made by it, but especially when we consider that we never, or we don't do it enough, I should say, put the environmental cost and the social cost of this decision that we make into perspective. When we do it, we see a totally different outcome. So I think that really underlines it. You mentioned 3 DGs that do incredibly important work. I shall say the sacred trinity of DG work that is being done. Well, let it now just be the case that we'll have them on the next panel, seated all together with some other stellar speakers. So no pressure on you, but we're expecting to get some good insights out of that, because we're moving into a panel in a little bit, which will be all about where do we stand, where are the gaps that we need to bridge when it comes to research, when it comes to innovation, what are the priorities that we should keep in mind, but basically how do we move forward. And you are in great luck, because that panel will be laying in the formidable hands of a true expert and a true visionary when it comes to the topic of today. And I'd like to call him to the stage actually just before we start. So can I also get a big round of applause for the Director General of the Commission's Directorate General on Research and Innovation, Marc Lemaître, everyone. Marc. Thank you so much for joining me. Shall we sit down? Maybe you get a stretch of the legs? Yeah, let's do it. Because, of course, I'm going to give you the floor in a little bit, because I think everyone is curious to hear more about some answers and some panel discussions that we'll have. But before we do, I do have to ask you, we've decided to gather all these people here together in Brussels. One might ask, why? And why now also? Is there a specific timing issue that made you and your team decide to do it now?
Hajar, thank you very much. Let me start, if you allow, by just correcting you. I am not the expert, and I am not the visionary yet. I count on this room to help me getting where you thought I was already. Let me also express my sincere thanks to Minister Khattabi and also to Executive Vice President Šefčovič for providing us, I think, with the best possible opening to this conference and, crucially, with their personal support. The fact that this room is filled, which fills me with joy, really, on a topic which is still a bit newish, I would say, to me demonstrates that we have all woken up now to the fact that climate change, beyond what we usually associate to this, is also a very quickly growing, I think, human health threat. And this has been, I think, on record indeed at COP28, which organized for the first time a health day. Vice President Šefčovič mentioned figures for Spain. I was myself struck by the figures for the EU, which were in 2022 that 62,000 people died prematurely from heat waves. And I don't want to be Europe-focused. I just want to mention this as just an illustration of what the global magnitude of the impact of warming must be across the world. And of course, heat stress is indeed by far not the only source of threats to human health. It was already mentioned. There are also infectious diseases which are spreading way beyond their usual areas. And increasingly, we have problems also of, I would say, resurgent undernutrition due to challenging conditions for agriculture around the world. So I'm really happy that today we can meet, today and tomorrow, in fact, in order, as you already pointed out, to identify where research can help in understanding the dynamics, the trends, and then hopefully also in helping finding solutions, which are indeed more about adaptation at this point, but we really need to find solutions to contain this threat to human health.
Yeah. And maybe, because that is interesting, right? And I mean, you ever so humbly said that the true visionaries are seated in front of you. I would agree, although I would still say that they're also seated next to me. But maybe if I can ask you to make that tangible for us, what are you expecting very concretely for an event like this? And even more specifically, I would also be interested in what is the process after these 2 days, right? You mentioned today and tomorrow us being here. What comes after these 2 days that we've spent together?
Well, my expectations are sky high.
That's good. I like it.
I am sure that at the end of these next 1.5 days, we will have managed to identify where the knowledge gaps are today, what we need to focus on urgently, and the way in which we intend to focus on what emerges is to develop a strategic research and innovation agenda for the coming years. But for that, we crucially need the input which will come from this conference.
Yeah, amazing. Well, then I would say sky-high expectations. You should not keep people waiting when those are to be fulfilled. I mentioned we have a panel which will be in your trusted hands, Marc. So it is with great delight that I can introduce a stellar lineup of speakers to the front. Also, you mentioned that the input of the room is crucial. So again, if at any point during this panel you have a question that you'd like to pose to one of the speakers, take out your phone, go to the Slido app and send it in, because there is some room that we have towards the end of this panel for maybe one or two questions from the audience. So make sure to do that. And with that being said, I will ask for your enthusiasm once again in welcoming the following people. First off, we have the Director General for Climate Action at the European Commission. Can we get a big round of applause for Kurt Vandenberghe? Then next, we also have the following. She is the Youth Envoy for the COP27 Presidency and COP28 Health Envoy. Give it up for Omnia Omrani. Welcome to you, Kurt. Omnia. We move on in welcoming the Minister of Health of Malawi, Her Excellency Khumbize Kandodo Chiponda. Give her a big round of applause, everyone. Then, searching for him in the room, a big round of applause as well for the Chief Scientist at the World Health Organization, Jeremy Farrar. Welcome, please. Welcome. We go over to another one of the Sacred Trinity. We have the Director for Health and Food Safety for DG Sante at the European Commission, Sandra Gallina. Where is she? Over here. Give her a big round of applause, folks. And last, but of course, definitely not least, I am delighted to welcome the Executive Director of the European Environment Agency. Please give it up for Ylä-Mononen, everyone. I will say, have fun, and I'll be back with you in a bit.
Thank you very much, Hajar. It will be my pleasure now indeed to start teasing out some of the wisdom we have in this room, starting, if you allow, Kurt, with you. Kurt, obviously, given his role, was at COP28 last December, where the EU joined over 100 other countries in endorsing the COP28 declaration on climate and health. So, on this, what longer-term implications for EU policymaking do you see arising from the COP28 declaration on climate and health?
Thank you very much for having me here, Marc. Kudos to DG Research for pulling off this conference so early after the COP. And I'm very nervous now when I know that you have this sky-high expectations. So I'll try to deliver together with my colleagues here on the panel. I think the COP28 declaration shows really a growing momentum among the health profession and the scientists, raising awareness and mobilizing for action. There is the COP28 declaration, there's also the Budapest Declaration of last year with the European region. And it's important for all of us because it really shows that health is a key driver of global climate action, and climate policy contributes in exchange to public health. And it's important to underline that climate action in the first place is not important for protecting the planet. The planet will take care of itself. Even if it warms at 6 or more degrees, the planet will always be there. But the human civilization, as we know it, will not be there in the same way as we know it now. And health is really a very good example of why we need climate action, why we need to protect the health of the planet in order to also protect our human health. So it's getting increasingly clear, I think, that climate change is a risk multiplier, including for public health. The climate crisis is indeed also a public health crisis. The Executive Vice President mentioned the warmest year on record, and since more than 100,000 years. Europe is warming at twice that rate. So in the best possible scenario, we will have to live with a Europe that is 3 degrees warmer, in the best possible case. But to make it even more complicated, we now learn from scientists, and that's where the science comes in, that there may be an change in the AMOC, the Atlantic Meridional Overturning Circulation, which would mean that if that tips, and scientists tell us there is a risk of this, we could actually go back to the to the ice age, with 6 to 10 degrees colder than we currently have. We simply don't know. So what it means is that the stability that we've enjoyed for such a long time in our climate and with our weather is very much at risk. So we need a better growing understanding of the climate risks, and especially to know how we get better prepared for this. You mentioned that it's really a question of adaptation now. I fully agree. It's not adaptation or mitigation. We need both. The best prevention is to continue to reduce our emissions and the drivers of climate change. But we need much more attention now for climate adaptation as well. And there we see that awareness is growing, but policy readiness is still too low, and policy implementation is too slow. And I think what the COP28 declaration does is to make sure that we all realize it's pressing, it's a systemic issue. It is really global because the whole world is confronted with this, and it needs a whole of government approach. This is not just DG Santé or DG Klima or the Environment Agency or DG Research. It's us all together. And again, kudos for bringing us all together and starting this process of defining a strategic research and innovation agenda.
You said it's about implementation also now, but can I still ask you whether you have further policy initiatives in your pipeline in order for the EU to live up to its commitments and where possibly research can help?
Very briefly, we don't sit still. There is no complacency. So we have come 2 weeks ago with our 2040 communication, where we have clearly signaled that we stay the course on climate action, and we devote quite some attention to the need also from a public health perspective to do this. We will soon, as the Executive Vice President was saying, coming with a communication on how to better manage climate risks. That will be based on a first ever systematic climate risk assessment at European level, for which we have been working hand in hand with Leena and her colleagues at the Environment Agency. Very much science-based, with lots of cooperation from many scientists across Europe and beyond. There, I can give you a little spoiler alert. It will show that global warming implies significant risks for our health and our health system. So we will really need to step up a gear on how we get better prepared, better ready, and look at what we can do to decrease vulnerability, especially for the most vulnerable in our society. We have the European Climate and Health Observatory, which again is run by the Environment Agency in Copenhagen. I think Leena can talk much better about this than I can. And let's not forget that there is also a very important international dimension to this. We have a good outcome of the COP28 in Dubai. Of course, the outcome will only be as good as it is implemented now. So we have lots of work to do. Also in going to COP29 in Baku, then COP30 in Belém in Brazil. But what we should do is to make sure that we also put health very high on the agenda there. And that's also where scientists should help us. We have a 2-year work program ahead of us where we will try globally to define the right indicators to measure and monitor the impact of climate change on our health and how best to respond to that. That's certainly an area where we expect input from scientists.
Thank you very much, Kurt. Turning now to Omnia. You are the youth ambassador of this conference, so you probably won't be surprised by my first question. How does climate change impact specifically the health and well-being of children and of youth?
Can you hear me? Is it working? Yeah. First of all, thank you so much for having me, and it is an honor to be the youth ambassador for this very important event. When we think about the impacts of climate change, particularly on children and young people, so the UNICEF in 2021 announced that half of the world's children, 1 billion, are now living in countries that are classified as extremely high risk to climate disasters. This means that climate disasters impacts not only the education of children, to be exact, 40 million children every year, by either destroying their schools or causing illnesses that keeps them out of schools, but it also leads to the displacement of 20,000 children every single day in the past 6 years alone. Children and young people are also uniquely vulnerable to fossil fuel-driven air pollution, leading to asthma and respiratory diseases that I myself witnessed as a physician, in addition to infectious diseases and malnutrition, which are the two main causes of premature annual projected death, according to the IPCC report. And last year was a very interesting year because the IPCC report decided to focus on how it will affect the global increase in temperature will affect children. A child that is born at the age of 10 or younger in 2020 is going to experience 4 times the rate of climate disasters that we are experiencing under the 1.5 degree scenario. And this can go up to 5-fold under the 3 degree scenario. But the evidence on the specific risks associated with how climate change affects children and young people remains very sparse. Frameworks are non-existent. Early warning systems still are non-existent. And the locally relevant and youth-led interventions remain under-resourced, receiving less than 0.76% of global climate finance. In a very recent set of dialogues that we organized under the name of Connecting Climate Minds, a welcome-funded project led by the Climate Care Center at Imperial College, we had 150 plus young participants share with us their feelings of distress and anxiety because of their first-hand experiences of climate disasters, and combined with the lack of meaningful integration of their perspectives, being not listened to, being kept away from decision-making spaces, and them feeling that they are bearing the consequences of the climate crisis with no opportunities to voice their opinions and their insights. These dialogues took place in Nigeria, in India, and virtually as well. So involving young people in decision-making spaces is definitely a critical pathway for A, protecting their mental health, and B, fostering their resilience. And youth engagement can only be meaningful if we reimagine and reorient the systems of power that consistently excludes young people, and instead create the right systems to empower young people from the grassroots to participate in decision-making spaces like COP and like here.
A stark picture and a very clear message from you. Talking about COP28, where you were the health envoy, I would want to ask you whether you saw in COP28 a positive change in the way children and youth are taking into account in designing climate change policy and also the research agenda around it.
Yeah, so when it comes to COP28, I'd like to take us a bit back to COP27, because the last 2 COPs really witnessed a historical transformation of meaningful youth engagement in this process. And I say that because it started with the Egyptian COP27 presidency. We realized that we should move beyond debating whether children and young people should be mentioned in climate decisions, to actually creating the spaces for them and choosing which policy positions that are youth-led and proposed by young people that should be selected and integrated in the negotiated outcomes of COP. And this is why, for the first time in 27 years, Egypt appointed the first youth envoy to a COP presidency. I was fortunate to have this position and to work and facilitate the youth-led perspectives directly into the design, the delivery of COP, up to the political outcome. We mandated the next presidency, which was the UAE, to also do the same. And they did it even better, because now the position has been permanently institutionalized within the presidency. Every single presidency for all future COPs is going to appoint a youth champion, and with an office that is being supported, that is being built for the first time within the UN agency, within the UNFCCC. In addition to that, we have organized in Egypt and in the UAE a youth climate policy forum, bringing in ministers, negotiators, and chairs of country groups for the first time together with young experts to have discussions and meaningful conversations where young experts in adaptation, resilience, just transition, loss and damage shared their proposed policy solutions, and all of these outcomes were integrated in the outcome decision of COP. Also, this year is very important because for the first time, the COP28 outcome decision mandated the UNFCCC to organize an expert dialogue around the disproportionate impacts of climate change on children and young people that will take place this year in June in Bonn in 2024. And this brings in a very important opportunity for today and for these important conversations to think about how can we fund research and research capacity building and awareness raising around identifying the specific risks and ways that we can, that climate change affects particularly children and young people. What are the child-sensitive and youth-responsive activities and solutions that need to be delivered to the policymakers to make sure that they are integrated in their national climate plans and their strategies, as well as in the negotiations that they go to every year. Finally, I cannot talk about COP28 without recognizing the first ever Health Day and the Climate and Health Ministerial and the Declaration. And we had the opportunity as youth-led organizations through, for example, the WHO Youth Council to deliver inputs and insights into the Ministerial Declaration that was adopted by 143 countries.
Thank you very much, Omnia. Let me now turn to Minister Khumbize Kandodo Chiponda. I hope the pronunciation was okay. Madam Minister, the government of Malawi has been a pioneer in the African region in taking action against climate change and achieving climate goals. Can you tell us a bit more concretely about those actions your government has been implementing?
Thank you so much. I hope I'm audible enough. First, let me thank the organizers of this function for inviting Malawi to be part of this very, very important conversation. We don't take it for granted. And also, thank you so much for making us to enjoy some of the cold. Where we're coming from, it is very warm. So we have had 3 good days of enjoying the cold weather. Let me just give a brief background. Maybe most of us were wondering where is Malawi? Is it Mali or Malawi or what? It is Malawi. It is a country in the southern part of Africa. Our neighboring countries, Zimbabwe, Zambia, Mozambique, and Tanzania. We have a population of almost 20 million Malawians. 1/3 of Malawi consists of a lake. We call it Lake Malawi, which hosts some of the most beautiful freshwater fish. In terms of demographics, almost over 75% of our population is under 35. So you can imagine how young our population is. And that brings us to a very, very important question, or indeed the impact of climate change on our population, which is practically very young. I will not say much, thanks to my dear, she's my daughter, not my colleague, she's my daughter. She has explained very well. She's very, very passionate about issues of adolescent, issues of youth, and the impact of climate change on the same. And this is the situation in Malawi. So we have not had it easy for us as a country for the last 3 years. Straight from COVID, we have had 3 or 4 cyclones which affected Malawi, and the worst one was last year, which hit Malawi on the 11th of March. It displaced over 2 million Malawians, and caused so much havoc. People lost homes, people lost crops, because that time most of us, we are agro-based industry. Economy is agro-based. So we literally depend on the crops which we grow. And unfortunately, the time we had the cyclone, most of the people in the southern region, they had already planted their crops. And most of them, the crops, they washed away. People lost homes, lost everything. We have some people still missing up to now. Even in the health sector, most of the health sectors in the southern region, they were affected. I think over 50 health facilities, and some of them up to now, they're not functional. We also had the West cholera outbreak. Some of our youth, especially here in Europe, they have had cholera maybe in the movie, or maybe, if they're taking science or they're training as nurses or doctors, but I can imagine the cholera is not something which they would know more about COVID and these other ailments than cholera. But we had the West cholera outbreak, a cholera outbreak which lasted a whole year. Under normal circumstances, you expect cholera, you have 1 or 2 cases during the rain season, because during of the rains, you have, damage to your sanitation and hygiene facilities, the boreholes, things like those, but not during summer. But we had the cholera outbreak, which lasted a whole year. And as we are talking now, at least Malawi, we are getting 1 or 2 sporadic cases, but even our neighboring countries, most of you have heard, they are struggling with cholera. And one wonders, why is it all of a sudden you get cholera even in summer? It's unheard of. So those are the things which we are talking about when we are talking about the impact of climate change. All of a sudden, you have strange disease patterns as well as burdens. Malaria, we thought we were in control, thanks to our partners, mainly Global Fund, for the support. We distribute mosquito nets to all the pregnant women in Malawi. Almost every year, we distribute over 10 million mosquito nets. We do vector spray, a number of issues, prophylaxis to the pregnant women as well. We thought we were winning the battle, but all of a sudden, the pattern has changed. We are still getting more malaria cases. Malawi is one of the countries who have introduced the malaria vaccine, because we took part in the pilot study, and now we have implemented. We are giving the malaria vaccine, but still we are still getting more cases of malaria. What exactly is happening? So we can talk about a number of issues. Not talking about even the drought. The drought will cause malnutrition in our children. Slides. Things like those. And then all of these, they're causing so much stress on our women, on our adolescent. Now that brings in another perspective of mental health. Mental health, it is real, and it is due to the impact of climate change. So as Malawi, as a country, having gone through all this, we needed to do something. Already, like I said, we're one of the low-income countries. Our GDP, or our spending on health is about 40 US dollars. I know WHO says we have to spend about, 140 per person on health, but we cannot meet that. So that is under normal circumstances. So you can imagine that under normal circumstances, you're already overstretched, and then you have climate shocks, you have one crisis after another. You cannot afford to do that. So as a country, one thing which we have done is that we have added now climate as part of our health sector strategic plan. We have the health sector strategic plan, which we launched last year, and climate is a big part of it. And the other thing which we have seen is that now we said no, because our pace is very small, we have little resources, let's have one plan. Basically, in one plan, we are saying, let all our partners come and help us, but using our plan as government. As government, we take lead. We want our partners to come and support us, support our plan. We are doing this because, like I said, in other programs, I'll give an example, HIV/AIDS management, we are doing so well. We are doing so well that in Malawi, almost 99% of everyone who is HIV positive, they are on treatment. Almost 100%, they are on treatment. That means we are doing very well. But then the same woman who is doing so well with HIV and AIDS is the same woman who's going to be affected by these other climate shocks. So we are saying, no, now let us stop being disease-centered. Let's just focus on the person. This person has HIV. This person is going to be affected because of the hunger issues caused by the climate change. How do we, bring everything together so that, at least we are able to support that person, not the disease? So that is why we are advocating for one plan. So we have one plan, which is focusing in all the areas. even those areas which are not, normally supported. I mentioned mental health. You find that in mental health, you find very, very few people supporting mental health, unlike HIV. HIV, you have so many partners, but mental health, you hardly get, partners. I mentioned about cholera. It was very, very unfortunate that when we had that cholera outbreak, you could not even get the vaccine because there are very few manufacturers. Even if you had the money, but you cannot get the vaccine. I can imagine if you find 1 or 2 cholera patients here in Belgium, how would be the outcry? I'm sure you would have the vaccines by next week, Friday, flooding the whole country. But that is the reality. We have to struggle to get the basic vaccine, even if you had the money, but you cannot get the vaccine because it's not there. You have to be on the queue. As I'm talking now, even Zambia, they're struggling. Mozambique, they're struggling. All of us, we cannot get, the vaccine. So that is what we are talking about. So we have done that. Apart from that, we also have, we have strengthened our primary health care, considering that we said, if we have a robust community health, primary health care, it is going to make a life very, very different. Because most of these climate change shocks, they're happening in the communities. So we need the solutions which can work in the community. What happens if the cyclone? How are the health facilities in the village going to, to be able to respond? If there's a cyclone, if there's a flooding, if there's a mudslide, how are they going to cope? So we are in the process of strengthening our primary health care, and that includes more health workers in our community. It includes community engagement. It includes collaboration between the Ministry of Health, Ministry of Local Government, Ministry of Climate Change, and Ministry of Agriculture, as well as education. And of course, not forgetting the faith groups, so that we work together, taking in mind that issues of climate change, they are cross-cutting, and I think that was already been, pointed out by the previous speakers. We have also, intensified on collaboration between our countries, cross-border collaboration, because, like I said, if you have cholera in Malawi, it means we put everybody else at risk within the region. So we need to have a robust surveillance. Public Health Institute, we have established Public Health Institute of Malawi, in Malawi, just to make sure that we, increase surveillance, self-case identification, and also responding to the same. So those are some of the things which we're implementing as a government.
You, in fact, already anticipated on the second question I had for you, referring to cholera, malaria, and also mental health. Still, I'd want to double-check whether there are any more impacts on health from a global south perspective that you would want to mention. And I would also want to ask you, referring to your integrated national plan, whether there is anything from a research effort perspective that you think would be most useful to you.
Thank you so much. So what I would want to add is that maybe what worries us, or what the challenges which we are having at the moment is that, like I said, there's little funding in the climate, sphere. There's so much funding. The mention of billions, trillions of dollars on papers, in books, in documents, but I've not seen anything on the ground. So that is really a worrying factor for me. Because for us, what we're saying, we are not talking about building preparedness, health systems which are ready to respond. We are talking about how do we recover? We are talking about loss and damage, because the damage has already been done as we are talking now. So we're not talking about how do we build preparedness in our health sector. No, we're talking about first loss and damage, because the damage has already been done. And this is real. This is the reality on the ground. Now, how do we recover? So I think it is very, very important that, we identify funding to help us in the recovery. But while I'm also talking about funding, I think the worry is that when there is funding mentioned, the conditions, the accessibility of this funding, it's very, very elusive. It's almost like they put spanners in the works that nobody should get a cent of that funding to do what it's supposed to do. So that has been the main, I think the main worry which we have. But otherwise, like I said, the issues of climate change, they are real. There are women who are suffering, there are children who are suffering, even the men. Our economies are suffering. We are already stressed with debt relief. We have to pay so much for debt relief, but how can you even pay your debts when you are having challenges which are affecting people on the daily basis? So we need, to create a conducive environment, and I'm very happy. And we need evidence-based. We need the research. Most of our countries, maybe the adaptation or vulnerability assessment report, which we have, they are outdated. But we need to have proper researched evidence for Malawi to do a proper vulnerability assessment report so that as a country we can have now a health and national adaptability plan as a country. But that we cannot do on our own, and that is why when I got the invitation from European Union, European Commission, I said this is an opportunity for Malawi that I go there to Belgium, and I'm sure when coming back, I'll come back with somebody who will do a proper, thorough assessment of our vulnerability and adaptation, so that now we can come up with a costed strategy of what exactly is it that we can do, so that next year we should not be talking about the cholera outbreak again. Next year we should not be talking about the malaria thing again. Thank you.
Thank you very much, Madam Minister. We are running a bit late, so I was told to condense the questions. Not talking about the answers. We turn to Jeremy now, who is the chief scientist of the World Health Organization. And the WHO is obviously a key organization on our topic of today, of climate change and health. Jeremy, which WHO recent or ongoing key initiatives would you highlight in the area of climate change and health? And what are the main challenges which you see in different areas of the globe?
Thanks very much. Indeed, I hope you can hear me. And it's great to follow again in another panel. And I bring the best greetings from Dr. Tedros, but also from Maria Neira, who's here in the front row, one of my closest colleagues at WHO, my first. I'm going to come speaking as a scientist, 18 years living in Vietnam, head of a funder, and just 8 months at WHO. So if I'm not completely on WHO message, please forgive me. I'm not quite institutionalized yet. I think there's one fundamental question we have to ask, which has sort of come through all of the talks to date in these panels and before. How is it that we're still asking the question, is climate and health a related issue, and how are we going to address it through research? I mean, we've known this for a very long time, and yet we're only actually coming to it now. And I think if we take a traditional approach to how we're going to do that research, we may not make the progress that we need to make at the pace we need to make. So we may need to rethink. You've heard just then the impact of climate on a country such as Malawi. And you may feel it's cold here, but actually it's 12 or 13 degrees, and it's only February here at the moment. My brother lives in Scotland, and in the middle of January it was 20 degrees centigrade in Scotland, and that is the new normal, but it's not normal. That is an extraordinary thing to say. And you also heard the impact on infectious diseases and others in Malawi, but no country is immune from this. whether it's in a baby's development, a maternal child health, as we've heard, in the impact on youth and mental health, or indeed on seniors at the end of their life and the impact of pollution and climate on dementia and cardiovascular disease, cancer, and everything else. So this is the whole of health. And we must frame climate as a health issue, I think, and it's not a health issue just for your children or your grandchildren, it's a health issue today. And one of our challenges, I think, in research is how do we deal with the fierce urgency of now, we need an answer tomorrow, with the need to also invest in that long term, because we will not hit 1.5, we've probably passed it already. We may not hit 2, 2.5, 3. We need science as well to inform us of what we're going to do in that scenario as well. And I think there's something of a dichotomy here between I need an answer this afternoon and I need an answer in 10 or 20 years' time, and somehow we're going to have to bridge those two. In terms of WHO's role, and Maria in the next day or so will talk about this in many, many of the sessions as well, and why did I in fact come to WHO? WHO does have still a unique mandate, a technical agency of the United Nations, 190-odd member states, the ability to convene, to work with ministries of health, but also work beyond ministries of health to the whole of government, which is actually what is needed. And it can be technical and scientific and advice and policy. But I would hope, and the reason I made the transition to WHO 8 months ago, is because I think it has to go beyond that. I think it also has to inspire. I think it's got to lift the eyes, particularly in our political agenda, who are so focused on this afternoon's news cycle that sometimes forget that there's some longer-term trends that we have to address. And how can the WHO play a voice and an influence and almost a conscience talking about these are the challenges we face tomorrow, the next day, but also in 10 and 20 years' time? And how can we raise our eyes and give an option and a vision and an inspiration for the rest of the world? I also think as part of the United Nations system, we now have a network convened by the Secretary General of the United Nations and a scientific advisory group. That is the first time in many, many years the technical agencies of the UN system are coming together at a chief scientist level and external advisors to ask the question, what are the great challenges of our time? And I think the ability of WHO and our sister and brother agencies within the UN system to come together and break down silos is going to be a crucial way that we can actually address these inter- and multidisciplinary things. Maria has recently set up the Research for Action on Climate and Health with the keyword, I think, 2 keywords, research and action. This cannot be talked about, again, in more conferences and meetings without moving on action. But I think if we don't anticipate that we have struggled, and I speak now from my previous life working at Wellcome, we struggled there for many, many years as to how to actually incentivize and fund research. Research traditionally and increasingly around the world is going down very vertical siloed systems. That's a real struggle for the scientists who then are asked to work interdisciplinary and multidisciplinary. And I don't think any funding agency in the planet has worked out a way to better incentivize people to work together. And certainly at Wellcome, we struggled with that for many, many years as we saw climate as another reductionist scientific approach, whereas actually it needed an integration and a multidisciplinarity. And I think as funders, and WHO can play a role in this, we have to think we mustn't just repeat what we're doing now in other disciplines, but how can we bring disciplines together? And if WHO can play a role in that, then I think it will have done a service for everybody. And then finally, I think what WHO can do is it can ensure that equity, as we heard from Malawi, in a world of mistrust and misinformation, that trust is built through action, not through words, and making sure that the world comes together at a time when the world is falling apart. That needs all of us to come together, and it certainly needs the research community to come together on both the fierce urgency of now and the longer term. And then I think finally a comment. I wasn't at COP28, Maria was there and many others from WHO. It's a privilege to join these meetings. It's a privilege to come to Brussels. It's a privilege to see old colleagues and friends or young colleagues and friends. These don't make the difference. It is what you do when you leave this room tomorrow and what you do over the course of the next 12 months, not in another conference and another meeting, but what is done concretely. We all in this room have agency and power. The question is, in the next 12 months, how will we use that for the maximum benefit of the maximum number of people to address the greatest challenge of the 21st century? Thank you.
Thank you very much, Jeremy. I do feel like I've got marching orders when it comes to promoting interdisciplinarity, and I take that very, very seriously as a research funder. Moving now to Sandra, our Director General for Health in the European Commission. Sandra, the European Commission for the EU has been putting out key texts such as the EU Global Health Strategy, and in that has also designed the One Health concept. Can you tell us a bit more about the change in the way the climate health nexus is seen inside the European Commission, and what is still missing to solidify this approach?
Good afternoon to everybody, and it's really heartwarming to see all the people here and perhaps beyond through the web stream. Let me say that many of us who are sitting here feel relieved that this is no longer, I would say, a niche topic, and I'm looking in particular to Maria. I mean, we all felt that when we were pronouncing the words climate and health, we were a bit like, junkies that were, on the wrong path. So I'm very happy to see a big room today and to see also that it is glorified by many people. We have a minister, we have had an executive vice president, another minister. I have my brother here, Kurt. In general, me and Kurt, we are a team for big things. So when they put us together, it means that the problem is quite big. Now, what is missing in my view, and I will be very blunt, this is a global and a cross-sectorial issue. So you were already starting to point at the issue, data, collecting data, understanding how it works. When you have a multidisciplinary issue, well, let me say, it's not so easy to put all the chickens together in a pen and to start discussing and to really see what is happening. So I'm very, very grateful to our colleagues from RTD, so Marc, Irene, Carmen. We have had fights about how to bring together all in the same poulailler. Because, at the same time, everybody wants to be very specialized, which is, it's the 19th century process of science, more and more specificity. You drill down to your atomic, I would say, specificity. But let me say, this is not going to work for this. Not going to work because, first of all, it's very much cross-sectoral. For instance, I tell you already that we are already embarking, after being very solitary in 21, asking for an observatory for health and climate. They looked at me like I was mad. Now, today, I'm embarking on mental health and climate. Because let me say to you, it's quite disturbing for people, not just the difference in temperature that is totally abnormal or the new normal, is the fact that floods, or I would say other events like drought, wipe out your possibility to live in a socialized environment. And we all have different levels of preparedness, but I can tell you, when the storms hit you, not even the most developed country has the real preparedness to deal with that. So we need to start to be resilient in our brains. And I think that Harari, when he wrote his book on the 20 lessons for the 21 lessons for 21st century, there was this, at least for me, the lesson I drew was you need to be resilient because you don't know what is going to be next. You don't know what is going to hit you. So first of all, this issue of collecting cross-sectorial data, we need to have good work with RTD, and also GRC is doing a lot of work with us. This is the places where they mix the things together. We are very much in our silos, unfortunately. Then the second thing is, I would say, you look at this issue and you can say preparedness. Of course, we revisited all our preparedness regulation. We have better preparedness in a sense. We even have now a senior level HSC which is Health Security Committee, which meets. I have better tools, but let me say to you that will not be enough because there's the global dimension. So if there is somebody who is not going to be prepared or ready, we will not be prepared. And I'm looking these days with quite some concern at Brazil and what is happening there, because with the change of temperatures, we have imported not just the tiger, I would say, mosquitoes, but we have imported dengue, Zika, and whatever you want. So we are getting new diseases for which we are not ready. As I told you, we will never be ready. We're running after this preparedness issue, and we're trying to get there, but no matter how much you invest, it's a question of having systems that are more resilient. And here I come to a real conundrum. We have figures, and they were even quoted, Minister Khattabi was referring to the fact that health systems produce so much, I would say, in terms of, heating. This 5% contribution to the emissions. I would say figures need to be checked, but in any case, it's quite paradoxical that our very health systems are producing what is creating climate change, which is impacting on the patients. And we were distressed in 22, yes, Executive Vice President was quoting, and I would say, even you, Marc, you were mentioning, I would say we are not partial to Europe, but the fact that there were 62,000 additional deaths, which we attribute to the heat waves, and this was 22. In 23, the temperatures were even higher. So it worries us. Projections, which are what they are, go to global numbers that seem to me very much underestimations, because we are not even in the 300,000, which I must say I beg to consider this figure very much the simply mathematical projection for the whole of the world between 2030 and 2050. No, I think we need to be much more going into the multi-disciplinary issues, trying to look at the global scale and try to pull together this exercise. And that requires a lot of political muscle, Europe is committed, I can say that, and I'm sure that we three Director Generals consider that we are doing our utmost to stay committed, but it's the whole of the college that is committed. Climate change is here, there's no dispute about that, and it's hitting you, humans, and it's hitting also your mental health.
Thank you very much, Sandra. Last but certainly not least, we have Leena, Executive Director of the European Environment Agency, an agency which has, together with the European Commission, launched the EU Climate and Health Observatory, which was already mentioned before. Can you tell us a bit more about the purpose of this observatory and how we could also build on it in the future?
Thank you, and thank you for inviting us as well in this panel. And great to also follow up. We have clearly the motivation to work on these topics. So the observatory was established in recognition that we still lack information, knowledge, and deeper understanding on the health impacts of climate change. And of course, we also need to make sure that the information and knowledge is ending up into the hands of those who can use it. So this is really the purpose. And the aim is to really support Europe in preparing and adapting to the impacts of climate change by providing access to the relevant information and tools, and foster also information exchange, also among this group of audience, and also cooperation between different actors, and also internationally. It is a European, but of course the scientific information should be useful also more widely. We are doing it with partnerships, so apart from Commission and us, there are also sister agencies, EFSA and also the ECDC in Stockholm, also Eurofound is in parts, and WHO Europe, Copernicus, Lancet Countdown Europe. So we are working also with, I hope, many of the audience members via the 6 Horizon Europe projects on climate change and health. So basically, this is a part of the adaptation strategy of the European Union, and is also let's say regarded as a key resource with the European climate law. What we can do with that, we are working in 2 years work plans, and the first 2 years we were concentrating on the main health impact. So heat, stress, that's its impact on human health, and also the infectious diseases like Xinguye or Zika virus. Now we are working more on the water, and this is also related to the water resilience theme that we are in the European Agency publishing a report on in May. And the other topic that we are working on very actively is capacity building, and basically ensuring that also the health professionals, those who are already practicing, in the field, can also really get more information, concrete information on the impacts of climate change on health. We need to ensure, indeed, that this information is getting into the right hands. It's not enough that it's lying in an observatory. We hope it to really be useful and practical to those who are needing to deal with these issues in their daily work. And of course, this conference, we hope that we also then get ideas what could be then the next topics and focus for the next 2-year work program of this observatory. And if you have not already, sought the website of the observatory, I hope you now do, and we'll ensure that you get the link. Thank you.
Thank you very much, Leena. And thank you once again to all our panelists. And with that, I hand the floor back to Hajar, with a slight delay.
So, indeed, we had sky-high expectations, and I do think that with all the diverse backgrounds that you shed onto these topics, we've really made a first good step. But we were a little short on time for the Slido questions, but don't worry. I promise you that we'll get to them in this next bit, so do please keep your phones out. But can I ask once more for a big round of applause for all our speakers and our formidable moderator, Marc Lemaître. Thank you all so much. If you'd like to take a seat back. Now, I have heard many things that really struck with me and also will stay with me, especially the thing that Sandra mentioned at some point, that there was a point in time where if you would mention climate and health, you would be looked at as a junkie that is down on the wrong path. Luckily, we're no longer in that scene, and we've really moved some steps forward. And to talk more about this interlinkage and the importance, but also the widespreadness of it, that is what we will be doing in this next plenary session, which will be all about climate change and how it impacts non-communicable and infectious diseases.